up to somebody's farm, you're going to pick up a foot like this one day, and you're going to think to yourself, I don't know where to start. Start with the necrotic, nasty tissue.
Yeah.
So start taking some out. Exactly. Just do what your normal thing to do. Obviously, don't try to draw blood. If you do, understand that it's possible. But you're starting now. So I know you said you didn't know where to start, but yes, you really do, actually, because you know what that foot's supposed to look like. So do what you're comfortable with. And for the farriers that are here, that's what you'll have to do. Do not be afraid to call in help on one of these.
Would be like dark.
It would be firm. It would be darker and firmer. It wouldn't be an unhealthy, cheesy looking stuff.
So it's not the color; it's the
It's a little of both.
texture.
It's
Okay.
color, smell, and texture.
Okay.
That do you like that little thing flipping over there in the wind? What's that thing? Get that thing out of there first. From a farrier standpoint, it's all about removing the bad tissue, the unhealthy tissue. Now, what'll happen is you will remove tissue and it'll be unhealthy, and you will think it will be a never-ending, bottomless pit. It will end, but you'll usually hit blood when it does. And I know the farriers don't want to do that without warning the client. I mean, you guys are not there to bleed a horse's frogs when you're trimming it. But if you grab a hold of one of these, you need to tell the client up front, I'm going to do the best I can. We'll see what you have. Oh, by the way, it's probably going to bleed. You need to tell them up front, because in 1 minute or two, he's probably going to hit a bloody section. The smell you smell, which this one's not real bad. This one's not too bad because I don't think it's as active. Is a butyric acid smell. It's a product of digestion of the bacteria. And I would just follow each one of those little black spots out and try to get them taken out of there. Yep. See, those will probably play out. See that? That's good. You're getting down to healthy tissue. This one's really not that bad, y'all. This one here is going to be.
So the black is unhealthy tissue.
Yes, the black is no good. The black is maybe a little thrush mixed in. I have a nickname for horses with canker.
What is it?
I call them job scared.
Yeah, I'll bet you do.
So she can't really feel when they're taking off all this bad tissue.
Not the bad. Just like cutting your fingernails. When you start to see the blood, that's when the sensitive tissue starts. That's when it starts down in there. I did that one time. He spent probably an hour out there doing what you're doing on 2 feet, just trimming. He came in here, I blocked the horse. I took a hoof knife and went right down, took the whole frog off. He was like, oh my God. And you talk about blood. It bled. But now that's the only way you can do it. It's like a cancer. You have to remove all the stuff. He's doing a good job in getting down there. It'll dull your knife and wear your back out and make your fingers stink.
You're welcome.
That's right.
This one's not as bad.
No, not like that other one. You might need a saws on now.
Anything on the ground?
I feel like every time they hit the foot, it's like they hit that and rocked up here on top of it.
Yeah. See, if I would have done that, yeah. Oh, it will.
It will.
I didn't have them nippers long enough.
It's pretty new too, ain't it? They were.
Yeah, I'm take some of that stuff.
I'm going by the horse too.
Yeah. He ordered them about 5 years ago for a guy and he never came and got them. He's
Just
raising
getting
the
down
price
the
on
line,
it. They keep going in the catalog.
I got a pretty
He's got 180 marked out. He's got 2.
Yeah, this is like a tumor.
Guaranteed.
It's almost the equivalent of a tumor. It's not a tumor though. Now we're going to get into some blood now. I'm about to get deep.
Like I said, give them nippers
I
long.
told you.
That?
Yeah,
That
get
meaty
that
chunk.
out. Now go easy now. That's sensitive.
Cut that out. I mean, just cut all that out.
Go easy.
Take it easy now. Don't bleed it.
Is that good?
Hold on. He's
Cut
got
some more?
He's got some heparin. You're doing good. I'm picking you.
You're doing a fine
You're gonna
job.
tell me to cut?
Here's the thing. We are nowhere near what's called the basement membrane.
No.
Okay? That's where the bad problem is. So we have to get enough of this off to get some medicine to it to try to kill it off. Okay? If that doesn't work, Amy, then we surgically take the frogs off. I block them. They don't feel it. And I'll take either electrocautery or a sharp scalpel blade, and the whole frog will come off all the way down to the digital cushion.
It'll grow back.
It'll grow back.
It'll
It'll
grow
grow back a lot healthier than what it is. See what I'm doing there? Just slowly working my way around, getting all that black
Now
out
you
of there.
now you said slow.
Yeah, slowly. And just the half. Here we go. That's what we're gonna do. For tonight, I'm gonna go get some bandage material and get some hemostasis going. We need to get the blood stopped, right? There's no use in putting Canker paint or anything on there tonight. It's just gonna be washed off with blood. So for tonight, we'll get some gauze. We'll pack her with some gauze. I'll get a couple rolls of elasticon, roll it around there. Tomorrow, Amy's going to start applying. This is the pain in the neck about these. The best way to treat them is they need to be bandaged every day. So it'll have metronidazole, Canker paint, metronidazole, acetone, and benzoyl peroxide. It has to be wrapped every day. You have to keep the foot dry. If that, after a couple weeks, does not really, and again, he'll know in 2 weeks. He's going to be able to tell you if this is healthy horn tissue and frog growing out. If it's not healthy, then we have to have a discussion about going to the next level, which will be liquid nitrogen. If I slip and cut your finger, I'll sew it.
All right, no charge.
Yeah, no, it won't be any charge. I better quit joking about that. Last time I did that, I whacked somebody's finger. I got him. Here, you get that right there. You still got a little. See that little warty? See how
Right
see the difference in the tissue here versus here, the sole and the bar. Get that little warty thing coming out of there. That's where your throat's coming from. This little area
Clean this
right.
out.
How do you what?
How do you know where to stop?
She's telling them. Watch her. She's starting to flinch a little.
That's what I wondered.
From the farrier standpoint, y'all will stop when it gets to this point, right? If I was going to go any more, I'd probably block this horse. Again, the goal is not to make her sore. She should go out of here no more lame than she came in. A little tender maybe, but she won't be lame. Key to what we're doing is the acetone, which is a drying agent. The organism can't live in it. And the benzoyl peroxide is an antibacterial too, and metronidazole.
Mini
Are your
cradle.
legs burning? No, mine are. Just watching.
Does that hurt?
My back's burning.
I don't feel a thing.
I'm hurting watching you.
You're doing a fine job, honey.
Mark, are you getting shit?
Hey, we'll roll. Easy, sister. Like I said, that thing will launch you into tomorrow if she wants to.
We'll catch you.
You guys, we'll catch you.